Hey guys, I'm Dr. David Wong. I'm a periodontist in Tulsa, Oklahoma, and today I just want to share a little bit about my technique on how I use the Acteon cube for extractions. All right, so guys, whenever we're talking about investing in piezo surgery technology for taking out teeth, one of the biggest things that people say to me is like, why would I invest, $1,000 or $10,000 in technology to help me take out a tooth? I already know how to do that. Well, I know that you already know how to take out a tooth. The reason that we do this is because in my practice, if I'm taking out a tooth, more than likely I'm going to be replacing it with a dental implant. And in order to do that, I need to be sure that I do as atraumatic a surgery as possible. And there's no better way to do that than with the Acteon cube. So I'm going to do this dry first. So whenever we're talking about, let's just say you don't have this machine and you're going to take out, let's just say a central incisor at home, right? It's not hard to do. It's one of the first things that we learn in dental school. You elevate, the tooth, luxate it a little bit, and then you just grip it and rip it, right? The problem with that is if you're doing a front tooth, unless you're like doing, a mission work somewhere, when you're in private practice, that's really not acceptable to do that because you could harm the facial plate. So what we're trying to do when we're taking out teeth in preparation for implants is we want to preserve as much soft tissue and hard tissue as possible. So whenever you're in practice without the cube, you're going to elevate and luxate with your regular, your surgical instruments, and take the tooth out the traditional way. When you're doing this with piezoelectric surgery, it's the same thing, except you're using a different tool. So whenever you look at the cube tip here, okay, so you're going to look at this. Anytime you have the cube, you're going to get a whole set of different tips for whatever clinical procedure you're going to do. I just happen to be doing an extraction, so you're just going to grab your extraction kit, right? And it's going to come with different tips. Now, what are these tips? They're exactly like what you have to take out a tooth without the cube. Like if you look at them, right? These are periotomes. That's just a periotome tip. Now, the thing that you don't have though is this thing right here called the Ninja. You'll notice that it's got serrated sides on it to really help you get out really difficult teeth, possibly ankylosed teeth or teeth that have root resorption and things like that. So that's a tip that you'll recognize in your office. The only difference now is it's hooked on to the cube handpiece. So whenever you go through here, we're just going to do this dry first, just like you would at home. You're going to use this tip interproximally, okay, distal lingual, mesial lingual, palatal. You could even use it facially, interproximally. But what's the rule of extractions on anterior teeth? You never use it facially. Even with an awesome machine like this, you never do that. Why not? Well, we know that almost 87% of all bone plates are less than a millimeter thick. So you don't want to destroy that, right? Even when you have really superior technology. So the thing that people get around have a little bit of a hang up on is the technique. So a lot of times when we're using our instruments at home, we can go into the sulcus and we're going like this, right? That's how you loosen up a tooth. You don't do that when you're using the cube. When you're using the cube, all you do is you sink it down over the bowl here so I don't make a mess for my assistants to clean up Monday morning. So what you're doing is you're actually going back and forth this way, not buccal lingual trying to loosen up the tooth this way. You're just going to direct your periotome tip right up the periodontal ligament, right? And you got to go real nice and slow, just like you would when you're trying not to tear up tissue. The reason you go slow, you don't want to create too much heat, okay? So you do the distal, and then you do the same thing on the mesial, okay? And you're just going back and forth, following the path of least resistance, which is going to be the periodontal ligament. After you do that, then I like to go palatal, okay? Then once you do this, there's two approaches at this point. Once you get about halfway down the tooth, let's just say you get down to like right here, you're going real nice and slow. But once you get to about a third to a half of the tip in, there's two different approaches you can have. You can carry on forward until you go all the way up the entire root length if you want to, or you can do a hybrid approach, which is what I like to do. So I like to get this thing about a third to a half of the way up the periodontal ligament space, and then I'll go with more traditional approach, because by that time this has already done 80% of the work for you. At that point, you can just elevate slightly and take your tooth out using a nice little twisting motion versus the buccolingual motion that we sometimes do. But that's the best way to use this machine without burning up your tips, so they last a lot longer, but also without traumatizing your patient, and also without taking all day to take out a tooth.